We've all been there. An accident happens and we want to help. Our instincts kick in and we rush to the scene hoping to provide some relief or assistance. But sometimes, the things we think are helpful can actually make things worse. Misguided actions, even with the best intentions, can lead to complications. This is especially true when it comes to first aid. Many of us have heard tips and tricks from friends, family, or even movies that are simply not true. There are a lot of myths out there about what to do in an emergency. These myths can be dangerous and can lead to improper care. Today, we're going to debunk some of the most common first aid myths. We'll explore where these myths come from and why they persist. We'll talk about why these myths are wrong and, most importantly, what you should do instead. Correct knowledge is crucial in ensuring the safety and well-being of those in need. Knowing the right first aid can make all the difference in an emergency. It can mean the difference between a quick recovery and a prolonged injury. It can even save a life. Proper first aid can stabilize a person until professional help arrives, preventing further harm. So, let's dive in and separate fact from fiction. By the end of this, you'll be better prepared to handle emergencies with confidence and accuracy. You bump your knee on the coffee table and immediately someone grabs an ice pack. It's a common reaction, almost instinctive. The idea of using ice to treat a bruise has been passed down through generations, almost like a family heirloom. Put this on it, they say. It'll help with the swelling. And indeed, the cold sensation can bring immediate relief, numbing the pain and reducing the initial swelling. But there's more to it than just grabbing the nearest ice pack and slapping it on the bruise. Sounds familiar, right? While it's true that ice can reduce swelling, applying it directly to the skin can do more harm than good. The skin is a sensitive organ, and direct contact with ice can be quite harsh. Direct contact with ice can cause ice burn, damaging your skin just like extreme heat would. Ice burns occur when the skin is exposed to freezing temperatures for too long, leading to redness, pain, and even blistering. This is the last thing you want when you're already dealing with a painful bruise. It can also slow down blood flow to the area, hindering the healing process. Blood flow is crucial for healing as it brings necessary nutrients and oxygen to the injured tissue. By slowing it down, you're essentially delaying your recovery. The better approach is to wrap the ice pack in a thin towel before applying it to the bruise. This acts as a barrier, protecting your skin from the extreme cold while still allowing the ice to do its job. This protects your skin while still providing the benefits of cold therapy. So next time you reach for that ice pack, remember to wrap it up first. Your skin will thank you, and you'll still get the relief you need. It seems intuitive. Nosebleed, tilt your head back, right? After all, it feels like the natural thing to do to prevent the blood from making a mess. Many of us have been told by well-meaning friends or family members to do just that. But is it really the best approach? Wrong. While this might stop the blood from dripping down your face, it actually sends it down the back of your throat. This can be quite misleading because it gives the illusion that the bleeding has stopped. However, the blood is still flowing, just in a different direction. This can lead to choking, vomiting, or even aspiration where you inhale the blood into your lungs. Imagine the discomfort and potential danger of having blood in your airways. It can cause severe coughing fits, a feeling of nausea, and in some cases, it can even lead to serious respiratory issues. The correct way to handle a nosebleed is to sit upright and lean slightly forward. This position helps the blood to drain out of your nostrils rather than down your throat. It might seem a bit counterintuitive at first, but it's the safest and most effective way to manage a nosebleed. Pinch the soft part of your nose just below the bridge and hold it for about 10 minutes. This action helps to compress the blood vessels in your nose, which can slow down and eventually stop the bleeding. Make sure to breathe through your mouth while doing this. This applies pressure to the blood vessels and helps stop the bleeding. Remember, staying calm and following these steps can make a big difference. If the bleeding persists for more than 20 minutes, or if it's a result of an injury, it's important to seek medical attention. Taking the right steps can ensure your safety and well-being. Remember that old wives' tale about putting butter on a burn? It sounds absurd, but many people still believe it. The truth is, butter doesn't help a burn heal. In fact, it can trap heat, causing further damage to the skin and increasing the risk of infection. Instead of reaching for the butter, cool the burn immediately with cool, not cold, running water for at least 10 minutes. Then cover the burn loosely with a sterile gauze bandage. Section 5. Myth 4. Making someone throw up after poisoning. Inducing vomiting used to be standard advice for poisoning, but not anymore. Forcing someone to vomit can be dangerous, especially if they've swallowed a corrosive substance, which can cause further damage coming back up. The best course of action is to call poison control immediately. They'll give you specific instructions based on the substance ingested. Keep a bottle of activated charcoal on hand, as it can help absorb some poisons, but only administer it if directed by a medical professional. Section 6 Myth 5. Using heat for a sprain. Heat can feel soothing on sore muscles, but applying it to a sprain is a big no-no. Heat increases blood flow, which can worsen inflammation and swelling in a sprain. Instead, remember the acronym RICE, rest, ice, compression, elevation. Rest the injured area, apply ice wrapped in a towel, use a compression bandage to reduce swelling, and keep the injured area elevated. Section 7. Myth 7. Removing an impaled object. In movies, heroes often dramatically pull objects out of wounds. In real life, this is extremely dangerous. The object might be stemming the flow of blood, and removing it could cause uncontrolled bleeding. Instead of playing hero, call emergency services immediately. Control any bleeding by applying pressure around the object, not directly on it, and stabilize the object to prevent further movement. Section 8, Conclusion. The importance of accurate first aid. Knowing the right first aid is crucial in an emergency. By debunking these common myths, you're better equipped to provide safe and effective help when it matters most. Remember, it's always best to err on the side of caution and seek professional medical advice when in doubt. Keep a well-stocked first aid kit handy and consider taking a certified first aid course to stay updated on the latest guidelines. Your knowledge and quick thinking could one day save a life.